area around the cervix in the vagina is known as fornices. So we can classify the fornices into anterior and posterior and also lateral fornices. If you are doing a speculum examination, you can clearly see the fornices. And you can sometimes see if the patient is having some discharge, vaginal discharge, cervicitis, you can see the secretions around this. You can in the fornices, especially in the posterior fornix, you can see the secretions collected. This is the posterior fornix. You can see the secretions collected in the posterior fornix. The posterior fornix is more deeper than this other two. And another thing we can clinically we can do if you are doing a PV, if you are doing a PV, especially in the lateral on the lateral fornixes, if the patient is thin or if the patient is having a PCOS or enlarged ovary, you can feel the ovary with your vaginal hand on from the and also another hand on your abdomen. If the patient is lean and if the ovary is somewhat enlarged, you can feel it in the vaginal fornices also. And also doing a transvaginal sonography. During the transvaginal, when the transvaginal probe is inserted, like the long probe which is inserted, and this probe is inserted into this area, this probe is deviated to this area to get a clear picture of the ovary. Another thing, we will move to histology of vagina. The vagina has mainly three layers: the mucosal layer, the submucosal layer, and the musculosal layer. And the muscular layer. Muscular layer have inner circular fibers and outer longitudinal fibers. And another thing is the fibrous coat. Here it's a fibrous coat, which is by the condensation of the endopelvic fascia. There are so many fascias here. From the condensation of the endopelvic fascia, it gives a fibrous structure. This vagina is very much like a stretching like structure because it facilitates the normal delivery. So it had to stretch. It's an organ of copulation, and also it is a like track to pass the menstrual bleeding. And also it is a like fibrous, like stretching type structure. And the supports of vagina we will discuss along with the supports of uterus. Then it will be easy to understand the prolapse. Another thing, this picture you had to keep in your mind. You had to remember this picture because it will help you to get a good idea about the structures. Okay. This is as you can see, the uterus is an antivater and antiflex structure. This is a bladder, this is a rectum, and this is the peritoneal layer. Okay, this is the peritoneal layer which is covering the anterior and as well as posterior surface of the uterus, and this is deeper up to the vaginal layer, and it reverts back. This is the utrovesical. Bladder is known as vesicle. This is a utrovesical pouch. This is a utrovesical pouch. Okay, this is a small pouch, and this is the recto-uterine pouch. Recto-uterine pouch. This is somewhat a deeper pouch, and it is the most dependent area. We can see that the most lowermost portion of the area. So if there is any secretion or something, it will be easily collected in the recto-uterine pouch. This pouch is also known as cul-de-sac also. Like if you're doing a follicular study, we can when the ovulation happens, you can see that in the report you can see that the fluid is seen in the POD. Fluid is seen in the pouch of Douglas. This is the pouch of Douglas. Okay. And this vaginal wall, this is the anterior vaginal wall. We had already mentioned that it is almost 7 centimeter, and this is the posterior vaginal wall. So you can see the anterior vaginal wall is related to the posterior surface of the bladder. Okay. This thing you had to remember, this is related, the upper two-third is related to the posterior surface of bladder, and the lower portion is related to the urethra. Likewise, the posterior vaginal wall, it is related, and in the upper one-third is related to the recto-uterine pouch, middle portion is related to the rectum, and the lowermost portion here is a perineal body. See. So if the vaginal wall gets laxed, if there is the supports of the vagina is reduced, or if the support is lax, then there is a possibility of the bladder to protrude into the vagina, into the upper two-third of the vagina. And if the anterior vaginal wall lower portion is lax, then this urethra will be protruded here. Likewise, if the posterior upper one-third, then there will be like this portion, cul-de-sac, along with intestine coils are present in the sac. So it can be protruded here. If the middle two-third is lax, then it can be rectum can protrude into the vagina. Okay. So moving to the applied aspect, as we had mentioned, when the upper one-third is lax, we can see the bladder can be protruded. This condition is known as cystocele. If the urethra is protruded, then urethrocoele. Okay. If rectum is protruded, then rectocele. If this from the cul-de-sac, the intestine coils are protruded here, then it is known as enterocele. If a lady after this vaginal hysterectomy, then if vaginal hysterectomy like that, if I'll show you something. This is the vaginal wall. This is the vaginal wall. Okay, this is the vaginal wall. After hysterectomy, this portion is blindly folded. Okay, because uterus and all things removed, only the vaginal portion is laxed. If the vagina is not properly lied to the surrounding structure, then what happens? This portion will be folded back and it will come to the lower portion of the vagina and even comes out. This is known as vaginal wall to prolapse. Wall means the ceiling, vaginal wall to prolapse. And another thing is uterine prolapse. Uterine prolapse also I will show.
Excuse me, doctor. Can you off the screen share so that we can we view you better? Okay.
Okay, then I will stop. Stop screen sharing. Okay.
Yeah, it's okay.
I will. Shall I repeat it again?
Uh, okay,
No
okay.
need. Okay. This is the vaginal wall. If this vagina and if this after hysterectomy, this portion is like sealed so that there will not be any entry of any organisms into the peritoneum. There may be a chance of peritonitis. So this portion is sealed. So if this area is supported to the nearby structures. So what happens if there is supports if it is not supported well, then this area will be due to pressure or gravity, it will come out. This is vaginal wall to prolapse. Another thing is uterine prolapse. This is the as I will also show. This is the vagina. And this is the uterus. This is a normal anteverted and anteflex uterus, only my hand. This is a normal anteverted and anteflex uterus. And it is usually placed in the vagina like this. The cervix portion is into the vaginal portion and it is situated like this. So when the supports of uterus is less, then what happens? It will this vaginal portion, this uterine portion will be descend into the vagina, like first degree, second degree, third degree. When it comes out, it is known as procedentia. Okay, is it clear?
Yeah, yeah. Carry on.
Shall I share the screen? Okay.